Okay, so we've hit 3:30 here in the United Kingdom, and a very warm welcome to our audience from around the world to our 13th, I think it is, Thought Leadership webinar. And each of these webinars has been designed to examine security in a particular context. And the thinking behind this is that the more that we critique the type of security we have today, the better options there are for a better type of security tomorrow. So our topic today is protecting public spaces. What are the implications of Covid-19? And once again, I have an international panel, 4 different countries: South Africa, Denmark, looking around. Well, France, United States, you'll hear about that in a minute, and Belgium. We've got an input from architects today for the first time ever, as well as security expertise. So it looks like it's going to be a great discussion. Don't forget, there's a question and answer button at the bottom of your screen. Can I ask you please to use that button to ask your questions, the question and answer button? And I'll try and get to it directly or incorporate it into other questions that I've asked. We've also had some sent in advance. So let's get started then. And I'm going to ask each of the panel to say a brief introduction. Once all 4 of them have done that, I'll ask each of them for their opening statement. Natalie first, please.
Hello, my name is Natalie Motham. I'm from Copenhagen, and I'm a head of institute at the Institute of Architecture and Technology at the Royal Danish Academy of Fine Arts.
Natalie, thank you. Kevin.
Good day to you all. My name is Kevin Bingham, a practicing architect from Durban, South Africa. I serve as a councillor on the UIA, International Union of Architects, and am a past president of the South African Institute of Architects.
Thank you. And Thomas.
Thank you, Martin. My name is Thomas Vonnier. I am an architect. I'm president of the International Union of Architects. I'm a US citizen, but I reside in France, and I'm also a member of ASIS International.
Thank you, Thomas. And finally, Emil.
Hi, good day to everyone. My name is Emil Blankert. I am head of security at the Forensic Psychiatric Center in Antwerp, Belgium. And I work for Securitas. So I can represent a lot of security officers around the world and in Belgium.
Thank you very much indeed. I'm now going to ask each of my panel for an opening statement, just 3 minutes for their views on this topic. Natalie, to you first, please.
Thank you very much. First, we are in a situation now where we are moving from a design paradigm of livability to securitization in our cities. That's going to last for a long time, and that's going to involve all of you in the security industry. Secondly, architecture and spatial organization is obviously a key element to the response to COVID-19. We know this relationship between architecture and health. We know it from recent history, but we also know it from more ancient history, all the way back to the Middle Ages. Architecture and spatial organization has been used to combat diseases and the spread of illness. Finally, I would say that we have to acknowledge that this is a different kind of security challenge from, say, terror or crime, asking for a different response. In Denmark, you can make you can separate a space by using a piece of tape, where, say, if it was a terror or a crime threat, you might need a perimeter wall. But because people are collaborating on this challenge, we can act differently in our spatial organization. The public trust, the public engagement is a key element and something we should think into our solutions responding to this challenge. Thank you.
Thank you very much indeed. And now to Kevin. Kevin, your opening statement, please.
Thank you. Due to the current pandemic, I suggest that we first review the definition of public space. Consider a country with a population of 60 million and an unemployment rate of well over 30%, a colonial legacy of the past which established the poorest living furthest from the economy, but more recently moving closer onto wastelands unfit for human habitation and living in single rooms and cramped conditions in informal settlements or in crowded inner city buildings. In these situations where the government has enforced a national lockdown, public spaces become the roads and alleyways between dwellings and shacks. Where 56% of the population live on €61 or less a month, that was last year's figure, the restriction of movement obviously has a critical impact on one's basic survival. For these people, the hope beyond COVID-19 of a new normal is unrealistic in the short and medium term. In fact, the very roads and alleyways are the breeding grounds of any disease. Both health and crime, and therefore protection, are interrelated with density. Localized unrest and law breaking has already taken place in streets, mainly due to confusion over the delivery of food parcels and a national ban on the sale of alcohol and cigarettes, oddly enough. So too have these dense corridors facilitated the spread of the epidemic. However, it would seem that South Africa is fortunate with its warm climate and a median population age of only 19.4 years, and 60% of the population under the age of 25. Consequently, infections and deaths have remained relatively slow. As we progress through the relieving levels of lockdown, the danger and risk with more freedom of movement lies mainly in the form of civil unrest in terms of crime and a disregard for social distancing and PPEs in terms of health risks. In regard to safety related to crime, the tried and tested methods of surveillance and access control will continue to be key. In terms of the redesign for health security, we have witnessed the measures taken in some Italian hospitals where subdivision of ordinary corridors into spaces and predefined zones ensure the limitations on risk of transmission. The principles of clean and dirty zones and corridors will see more implementation in general design. Triage, or the assessment of health risk prior to admissions in health facilities, which are public spaces, will require greater spatial planning. Health screening could become the new normal at entrances to offices, schools, and public facilities. These areas, also serving a triage purpose, would see the reintroduction of the vestibule, an architectural anteroom or hallway at the entrances to buildings. How might we establish a guiding framework? In a speech presented yesterday at an online conference of the Council of Europe on civil participation in decision-making, the mayor of Tbilisi in Georgia addressed matters on public spaces. The proposal in his speech addresses the public participation in the division of the city's public space, in this case into areas for children, dogs, and for football. The proposal is for co-design, involving the community, and I strongly support this democratic approach. Thank you.
Thank you very much indeed. Interesting, Kevin. Thomas, your opening statement, please.
Thank you, Martin. I'm going to echo what Natalie and Kevin have said. Buildings and public places are really at the front lines in this pandemic crisis. I was in Korea right before the pandemic was declared, and I was very impressed there by how important public messaging is and how important examples are in the public places. Right now, I think the world is still coping with the emergence of this pandemic, and it is early to draw profound conclusions about what the future might hold. We are coping at the moment with security-related problems in entrances, at various checkpoints, in cashier lines, in retail stores, in lines in other environments, in checking the public for masks, and looking at temperatures, and making markings in the environment to reinforce public distancing. I have some conclusions nonetheless about the developed world. I think the distinctions between workplace and residence are blurred, and they will remain blurred, and that has profound implications, I think, for corporate security. I think the outdoors is likely to become much more important in the recreational environment as public pools and gymnasia and other places of gathering for physical exercise become difficult. That too has a set of security implications. And overall, in reinforcing, I think, what Kevin has said, I would say that sanitation is going to be key in office environments and in public places. And that carries with it a whole host of implications for security. I'm prepared to talk about those in some detail based upon work I am now doing with a client for a facility that has about 250 employees and is poised now to reopen. And I'll go through some of those as we get into this a little further. Thank you very much.
Thank you very much indeed. And finally, Emil, your opening statement, please.
Good afternoon. I'm actually very interested in hearing the opinions of people with the architecture background, as we are in our sector, security sector, forced to also think about the importance of buildings, maintaining the social distance in them, and how we are able to change it. And I think it will be a very important role to play for architects and designers in the years to come, into making our spaces, public spaces, ready for something like this. And because the spaces, you can only change them that much right now in a few months. If there are infrastructural problems, infrastructural changes need to be made, then yeah, you're out of luck somehow. So the most important role for us as security personnel is to maintain the social order, to check on people if they're maintaining social distance, explaining the rules to them as well, and to do this in a kind manner. So I myself work in a forensic psychiatric center. So we have about 350 people, personnel there, and there are 190 patients. And so maintaining the social distance there is quite difficult. But the visitors that usually come 4 days a week have now been canceled. So the patients cannot get any visitors now, which creates even different problems as well. But the front line is absolutely the entrance place in the building for us as well. Like, so reception place where people are met for the first time, where they are asked the first questions like, where do you have to be, or where do you have to stand or sit? Those are the simple things, but maintaining social distance there is highly important. And we have as well made several analyses of how to do this properly. And we have changed a few things as well for dropping off goods. We're doing it outside of the building instead of inside, as there were just not enough options to do it inside. So I think in that way, your insights are very interesting to hear how to design buildings in a manner which is still aesthetically pleasing, which is still nice to be in, but you don't have to linger in it, of course, too long. You have to be able to maintain the social distance. So I'm very interested in hearing your expertise.
Emil, thank you very much indeed. So just to say to the audience that you have a question and answer button at the bottom of your screen. So please do ask questions on that button, and we'll endeavour to get to those. So one of the themes that's cropped up on previous webinars, and the reason for today actually, was that we've been hearing about some of the things that you can do to enforce social distancing, about markings and having a security officer there to enforce it. But I wonder whether there's something, is there anything dramatically different we can do that doesn't involve a massive design, perhaps that we could learn from the health world? Because one of the corporate security managers made the point that enabling people to work 6 foot apart is not a big deal. What is a problem is using the toilets, having lunch, and these are dramatically serious issues. Let me come to you first, Kevin. Are there any great lessons we can learn from this issue that have been tried in the world of health that we can take to the world of security?
Thanks, Martin. I can comment on that. Much of my research in medical architecture has taken place linked to respiratory illnesses. In Cape Town, which is in South Africa, as you'll know, I've worked at 2 hospitals there, research work in terms of TB being a respiratory disease, and it's rife in the Cape Province. And in fact, in our country, we have 330 deaths a day from TB. And it's really to do with isolation and ventilation. Those are the 2 major key points, isolating of patients with respiratory diseases, and extraction or ventilation within the space that they are, so it doesn't spread to other people. The interesting research that I perhaps have done is there was linked to CO2 level documentation, working between the male medical wards and also working in the ENT and also into the accident and emergency. Sorry, I meant accident and emergency. And then we found that the most risky places for catching TB happen to be in the staff area. The greatest concentration of CO2 was in the staff rooms and not necessarily anywhere else. So flow of air is critical in a medical facility, and extraction is key.
Thank you. Natalie, let me come to you at the same point. Just an interesting point, Albert Dubler has just put a question about the situation in Korea. And of course, things do vary markedly around the world, but he's right, he says he's right, you're right, Denmark's definitely done a better job than some countries around the world. What can we learn?
Well, just to give respect to the rest of the world, this challenge is coming at different intensity to different places. Denmark is a small country. Our biggest city is a small city compared to many other places. So just to put it into context, but we do have some experiences and have made, of course, learned a lot in the last few months and have succeeded in flattening the curve. What we see now for offices, to go back to the point of how to organize space differently in this time, what we see now is things that I think, as Thomas said, will continue. We see a rotation of a workplace, so you don't have a full presence of a workforce in a building at the same time. If you have, say, for instance, an office building, maybe you have a 60% presence at any time and rotate to have alternate days to work from home, for instance. Then also we've seen something interesting in the internal life of the building, which is the one-way street has come into office spaces. So basically, because as you also mentioned, circulation is key. We need to control, of course, the working space itself and its distance to the next working space, but much more difficult is circulation. Circulation is everything. So we need people not to run into each other in hallways, not to run into each other at the water cooler, stuff we normally like. And one of the easy tricks to helping this is making one-way circulation.
Thomas, you said you would tell us a bit more as the webinar goes on. Good timing to ask you for a bit more. You bridge this gap between architecture and security. We do need some answers. What are the key things that you were saying in your opening statement we can learn? Just a few more details, please.
Well, I think for security professionals and people who are on the front line in buildings, example is everything. And these are people who are going to be exposed to risks in dealing with the public and in dealing with people coming and going from buildings. So I think the industry itself has to be prepared for a new set of standards in terms of comportment and what is expected of them. These are enormously complicated matters. I'll take an example that Natalie and Kevin know well. Our offices in Paris are on the 47th floor of a 56-story building, the tallest in Paris. It receives supplies and something on the order of 5,000 people a day under normal circumstances. It receives mail, it receives all sorts of things that come from the outside world, and it has 6 elevators serving those 56 floors, 2 of which have been reserved for an observation deck that is open to the public. All of that is changing, and that building cannot reopen and will not reopen until there is a plan in place for how the elevators will be used and how supplies and mail coming into the building will be handled. I think all of these issues, logistical issues and personnel issues, are going to face security personnel first and foremost. In the case I mentioned of a 200-employee firm, I'll just go through a number quickly of the things that are being implemented. Number 1, a clean desk policy. No desk may have anything left on it at the end of the workday in order to facilitate cleaning of the premises. And all of the horizontal level flat surfaces are now being, in a sense, policed and examined for how they can be cleaned properly. This is my point about sanitation. There's a study by MIT released last week that says the sneeze blast, that's the term they use, can travel as far as 27 feet. That's 8 meters and some. So this idea that 6 feet or 2 meters is somehow adequate is, I think, going to be challenged constantly. And that will mean that in these environments that are essentially closed and where people are dealing with environments that others have touched, sanitation is going to be an absolutely key factor. Kevin has mentioned air circulation. I think sunlight and air both are going to become much more important in interior environments. There's a risk associated with restarting the HVAC systems that have been closed now, in some cases, for 2.5 months, 8 weeks plus, because these systems have stagnant water, which carry another set of risks, because they share circulation between spaces. All of that's going to have to be re-examined. Common equipment, kitchens, areas where coffee has been served or taken, all of those places are going to be closed down in this office environment that we're working on. And those amenities and pieces of office life that people enjoyed are going to be out of the picture for the foreseeable future. There's more, but I think you see that as our physical plant and our physical environment changes to adapt to the real concerns and the imagined concerns, because I think we must acknowledge that there are certain fears and stranger danger phenomenon that may not be based in rational fact, but are nonetheless part of the environment. All of these things are going to have implications for facility managers and security personnel, and they'll have to work closely with facility experts like architects.
Thank you, Thomas. I'm going to come to Emil next because, as Thomas said, this is crucial setting an example on the front line. And we've had in previous webinars, Emil, people talk about the challenging facing security staff there. How are you finding the management of the, I suppose mostly it won't be public at the moment, mostly it's going to be personnel working in premises. But I mean, when the public come along, how do you, presumably a major challenge for security, how do you see that being met by the security sector? And do you think that security officers are up to the challenge? Two questions, Emil.
Well, first of all, what Thomas said is absolutely true. So sanitation is very important. We have been doing this since the beginning of March, also to be cleaning all the door handles, doors, keyboard mouses ourselves. We're doing this very often. We didn't use AC for a long time for the same reason. Now we're using an AC in our control room, which is closed circuit. But the main role for security officers is absolutely on the front line, and it is to explain it to the public. Now, the public in this case is also the personnel, because the first few weeks were, of course, the most difficult, because you have to explain it to them. People understand it, but they tend to forget it quickly as well, because you're talking to someone, you're not maintaining these 6 feet distance, you're getting close to someone. It's natural for people to do this. So our agents who are sitting in front, who are having to screen the personnel, they constantly have to say, well, we have to maintain the distance. And after a while, this gets easier, but we tend to notice that it's always, it's better, and then it slows down a little bit, because it's a natural way for people to act around another. But in this setting is actually a healthcare setting, so it's more strict than before. So we've always been a little bit ahead of the government measures in Belgium, because we, of course, want to keep everyone safe there. And I do think that we are up to the challenge, the security personnel, absolutely. But a very important point is we will need more specialized training. One is that we have to be able to communicate these measures in a really calm manner, because of course, if there are altercations, physical altercations, they have to be absolutely avoided. If people touch each other, or is it a fight, is of course not the way to go. And secondly, we have to keep monitoring them as well. So the personnel, they have to remember all the measures as well. They have to watch everyone else, and usually it's only 1 or 2 security officers who are there. So we also have a lot of our colleagues working in supermarkets, working in public space right now, and they are having quite a bit of trouble, especially in the first few weeks, because people did not really accept that they have to use, for instance, a shopping cart when the only thing they want to buy is like a pack of smokes and Red Bull. This is a literal example. But of course they have to do it because it maintains social distance. And also there, the agents are on the front line, so they have to explain, I'm sorry, ma'am, sir, but you have to use this and that. People get agitated, but as the time goes on, as a lockdown, as we don't really call it a lockdown in Belgium, but as it goes on, people get more and more used to it. But I think it won't last that long. So we really have to maintain these measures for a longer time. Because as people hear there's less and less hospitalizations, they'll think, oh, the crisis will go over, or it's much better now. Maybe we can start going back to normal life, which is not the case and won't be the case for a certain amount of time. I do think quite a long time.
Thank you very much indeed. Okay, an interesting question. I'll come to you, Natalie, first on this one, from Vania Kakato, a former panelist, by the way, on a few weeks back. She's got an interesting question. We're talking about workplaces most of you have so far. She asks about public transportation. And we may need to think about transit facilities that gather massive numbers of people and rethinking that issue. Has that cropped up in your life, Natalie, as an issue? And what are the sorts of thinking there? I assume they're quite different.
Well, I would say that that's one of the big challenges when we begin to reopen society. Because in the closure of society, you take people out of public transport. You reduce the number of people who use it. And you can then use simple measures like requiring that you reserve a seat, and then you can make it possible only to reserve every 4 seats, for instance, in a train. We are seeing measures like that in Denmark, but it reduces the amount of movement in public transport enormously. It moves, of course, the closure of societies reduce mobility altogether, take people out of transportation. But we also see a movement to the private car, because of course in this context it's a secure, like the shopping chart mentioned before, it keeps the social distance. So I would say that moving forward we need efficient, sustainable solutions for single person transport, because the car is not good enough as it is.
Thank you very much indeed. I'm going to come to you, Kevin, because I think this is a really good point, this one, that it's easy in theory to come up with ideas about having fewer rows on planes and what have you. But it's obviously going to make the cost of this very, very high, and it may, for all I know, not even be doable. Is this just a reality? We're going to have to face a new world in which it's just going to cost more, or you're going to have to take the car? Kevin?
I think we have to think about how these diseases are passed from one to another. It's ingress through your nose, mouth, or eyes. We all know that there, and through touching the surface and passing it on, and therefore your hand being at your face. The research that was done again in the spread of tuberculosis in aeroplanes showed that it was in fact the person 2 rows in front of you from a cough or a sneeze that spread could happen. So I'm sure it could go beyond that, but it was just not the person dead ahead of you that was the one at risk. So I think that, going back to what I said about buildings, I think this front of house or vestibule is going to become the testing area for everyone, whether you walk into an airport or whether you walk into a train station or whether you go into an office. So we're going to have means of being able to test people's temperatures, and that I think is going to be the only way. As time passes, you'll find that people become more lackadaisical about this here and the spread, and once the virus has some antidote, you'll find that will fade away. Okay,
thank you. I'm going to make it even more difficult for you, Thomas, because I've got 2 questions here from panel. One is Parnell Lee, who's talking about the issue of when people are evacuated and the whole process of evacuation. I can only imagine that the sort of issue that's going to occur, both from buildings into public space and from public spaces. And the second one is from Elizabeth Sandstrom, who asks about schools and how they're going to work. I just ask you for a comment, just in case it's different to transport and buildings. I assume there are some different implications. Thomas?
Well, I think some of these are not clear to us yet. I live in Paris, where the subway system is very dense and densely used, where circulation of air is quite confined and where you are in very close proximity to other passengers no matter what. And I just don't think we know yet how that's going to work out. The wearing of face masks in public, the admonitions about touching things, all of those will help. Eventually, one hopes there will be vaccinations. Eventually, one hopes there will be some level of immunity. But until then, I think we're in uncharted waters when it comes to public transit. I certainly support Natalie's comment. I don't think the private passenger automobile is the answer we need, and we are seeing the development of many other alternatives, at least in fair weather, and so may that continue. To respond a little bit to what Emil said, I think we're going to see the advent of touchless systems on many levels. There are touchless doors, there are touchless keypads, there are all sorts of touchless technologies that are available and can be implemented. I'm hearing about certain robot technologies that can be useful in certain applications. And although I understand the rush to take temperatures, I think medical science is going to prove that that's a rather unreliable indicator of anything. And I think we have to operate as security professionals and as architects as if everyone is contaminated. And there is no such thing as immunity or exposure that is over and now means you're no longer at risk. I think the posture must be that everyone is a risk to everyone else, and we have to sort of operate accordingly. I have not seen anything about evacuation plans or had any experience except to say that in the immigration processing areas of major airports, we have seen serious difficulty in maintaining any kind of distancing as crowds gather and as backlogs develop. And now that travel has diminished greatly, those problems are diminished, but every indication is that travel is again increasing, and at the same time, scrutiny at borders is increasing. So it's easy to anticipate that there would be more difficulties like that. And I think those are problems people will have to tackle. Probably enough for now.
Okay, Thomas, yeah, I appreciate there's much you can say, but I appreciate that. Emil, what is striking me from these conversations is that the security sector is going to need its clients to pay. And you mentioned paying for training, but it strikes me they're going to have to pay a lot more for a lot more services. It's going to cost more, isn't it? And will they be prepared to pay, in your view?
Well, I think this crisis is going to cost a lot of money no matter what for governments, and of course for almost all clients. So I don't really see anyone escaping from that. However, it's a really necessary investment as it concerns the health of not only personnel, but also visitors and the global public. So yes, there will be investments, but I think that security personnel and security management plays a key role there as well in conversing with the clients and to see which are the best solutions for that client. And you have to check on which sector it is. For us, it's the healthcare sector, so it has to be quite strict, which is of course different than, say, a supermarket or a guard at a museum, but they all will have to make certain investments. It's not really uncanny to do so, because the buildings, as you know, are not all prepared for these kind of crises. So I think that investments will have to be made, absolutely. But I don't see how any clients will say, well, no, we won't do this, as this is a global phenomenon. So I think there will be a really interesting market for when everything reopens as well. A lot of innovation will come our way. A lot of entrepreneurs will make new solutions. So I think this will be a good time for new companies as well to thrive and to really find perfect solutions and try to make it perfect, of course. And for clients to actually work together and see, okay, we can implement this into our buildings, or we can use this for our personnel. Given the infrastructure we have right now, we are better off with this or that. So it will have to be tailor-made, each and every one of them, I think. The most difficult part is what Thomas said, the most public places with most people, public transit, things like that will be, I think, the greatest challenge.
Thank you very much indeed. Let me move on. I'm just going to fire some questions just because we've got quite a few, and I've got a few sent in advance. Dr. Matt Hopkins, do the panel feel we'll be moving towards spaces, buildings that design out the health risk in the future can be coexist with designing out crime at the same time? Natalie, you've put the case for the designing out health. I mean, is this always, and is this obviously linked to designing out crime at the same time? Does it translate in quite the way we hope?
Well, not necessarily. And actually, if we manage to find solutions to manage this risk that are not very heavy-handed, there will be no big correspondence. Because I certainly hope, Thomas mentioned that this is both about real but also perceived threats. There's a lot of politics in this. And we do risk moving forward to act on both the real and the perceived threats in such a way that we make a very restrictive environment. If we do that, there will be a correspondence with security regarding crime and terror. But if we do manage to handle this in a different way, in a way that to a higher degree built on public trust and civic responsibility, maybe, but not necessarily a big correspondence.
Interesting. I'm going to ask a different question, if I might, because we've got quite a lot to get through. I've got a question here from Marshall Kent, who actually lives in Kent, England, not far from me. He asked a different question. Maybe I'll come to Thomas for this one. He says, does the proposed lockdown proposals and the new normality reduce the threat and opportunity for terrorist attacks in public places? Are new vulnerabilities and opportunities being created? I thought it was a good question, actually, because that was a big preoccupation, Thomas, before COVID-19. What do you think post the crisis?
Well, I think the fear of aerosolized contaminants, of which clearly the coronavirus is one, has not gone away and will not diminish. And I think fear of the unseen is a very powerful emotional force. And so in that sense, I do not think the terrorist threat is diminished at all. And I think perhaps it is heightened in some respects. Of course, without large public gatherings, that changes the formulation. I think from a security standpoint, Martin, and to your questioner, I see a movement toward operable windows in buildings. I see a movement toward widely expanded working hours at lower densities. And I see a movement toward access to the out of doors so that people who work in confined environments can go outside from time to time, whether that's on a terrace or at ground level. All of those things mean that exposure to risks from burglary and incursion are increased in my estimation. And it also means, I think, that natural surveillance and the sort of proprietary interest that employees have in protecting their workspace becomes complicated. If you have fewer people occupying large spaces, it means that there is no natural surveillance. And so the things you might expect to operate naturally will no longer work in quite that way. So I think that the risks are changed, but not really diminished, I guess is the way I would sum up.
Thank you very much indeed. Kevin, I'm going to come to you next. A question from Simon Roberts, who says, can architects assist by identifying optimal capacities based upon space available within a site? Security could enforce those capacities, reducing stress on public and private space. Interesting point. Is that what architects do? Is this a good way to go?
Ordinarily, architects do make use of documentation that advises on square meterage or square footage related to uses of spaces. So that is a norm anyway, and that's where we start our design processes often in our brief from clients. So I think many of these things will be written into norms and standards that governments around the world will make use of. And I think it's really specific to the context in which you find your building. I think I said earlier in my intro that I think a warm climate will be different, obviously, from a cold climate, and we've seen that in colder climates, the risk of catching this COVID is greater, I think, and I think that's one of the key points. I think it's enough for now. I've got a closing statement. I'll say more.
Okay, very, very good. Well, let's one more question I've got for Emil, and Emil, this is from Tio Guan Teng. And if I could ask you just to be very brief on this, he's asked, with the introduction of restrictive measures on people such as social distancing, how will security officers play a role in public spaces such as parks and beaches and resorts? So get away from the easy ones. Let's talk about the more difficult ones. If I could ask you to be very brief, Emil.
Number one will be to be the gatekeepers, as we are in different spaces. But I think public spaces outside will be used much more as they are right now. In Belgium, we can really see this, that many, many people are outside now doing sports, which they did not do a few months ago. And our role will be really to work together with the police force and the government as well in making sure people are really doing the things that they can do, and they maintain social distance, and to go to them in person and really explain, like, you cannot do this like this, or you have to maintain social distance. And we should really do this. You need people on the ground for sure. You can't just use pictograms, you can't just use visual cues. It's not enough. We can really see this in practice. You really have to have people on the ground and who will be there with a smile, but also to be there and maintain the order.
Okay, Emma, thank you very much indeed. Well, I really appreciate it. I'm now going to ask each of my panel for a closing statement. They've only got 35 seconds each, so they're going to have to be concise, but they're good at that. Natalie, can I come to you first, please, for your closing remarks?
Well, just a focus in the moving forward, I think we will see, I mean, we are talking about how we need more space for everything, but we will see a downsizing of many formats, from mega to the pocket, from the mega market to the localized pocket market, from the mega amusement park to little entertainment, because we're going to need to control size of attendance. So there'll be a change in and innovation in what kind of spaces both private and the public will design in the future.
Thank you. Kevin, your closing statement, please. Just 35, 40 seconds, please.
Thank you very much. Martin, if I could just start off that Thomas said earlier that we're in a time of uncertainty, and that relates to us having a vaccine, which I think is the critical element here. And also Natalie's made some mention of facilities that hold masses of people. We haven't spoken yet about sports stadia and theaters and things like that. I was thinking while she was talking about these silent discos that the youth go to where they wear headphones. And I think we're going to have to think of those type of things in terms of distancing until the vaccine comes along. And finally, I'd like to say, all architecture should be good architecture. All architecture should be good architecture. And that encompasses healthy buildings, that encompasses security and sustainability. Thank you.
Thank you very much indeed. Thomas, your final comments, please.
Thanks, Martin. Well, the first thing I'd like to say is that I think for the professionals who work in security, and I consider myself to be one of them, this means that our domain is going to expand. That is, the number of factors we have to consider are much broader as a result of this. And number two, it's complicated. It's not easy. And it exposes frontline personnel to a new set of risks and responsibilities that are going to have to be adapted over time. I think the notion of privacy and what is one entitled to expect in the way of privacy, both at home, if you're working from home, in public places and in office environments, is going to change radically. And we've seen that certainly already in the tracking and contact tracing that's gone on. And I expect that will become more complicated. I think there's a whole new set of protocols. Emil has touched on this. I don't think this gets easier with time. I think it gets more difficult because emotions rise, frustrations grow, and anxiety increases. And as that happens, there have to be policies and procedures in place to handle situations that arise from those factors. And architects and security people and facility managers and HR departments are going to have to work together to get these things in place to accommodate what I am quite sure is going to be more widespread, and we've begun to see already in a number of places. So stay tuned is, I guess, my final message, and let's continue this kind of exchange.
Okay, thank you very much, Emil. Final comment to you for your security input. Just 30 seconds at the most, please, because we're just running out of time. Emil, your final comments.
Well, I think that in almost every country, we need more multidisciplinary work. We should not only hear from economists or virologists. I think there are a lot of leading experts in different sectors who have a very important insights, which can help us create a solution as a whole, but we are not hearing them enough. So I can only encourage conversations like this to be held much more frequently in the future.
Emil, thank you very much indeed. Well, thank you very much indeed to my panelists for their insightful comments. I mean, what is crystal clear, I think, and indeed the object of thought leadership, is that this is a rapidly developing area. And it was quite striking to hear experts who work with the security sector but aren't in it, telling us that it's complex, it's going to change, and we need to think differently. And even in their areas of expertise, there are still many unanswered questions and still many issues to think through. Perhaps encouraging that we can learn from other areas that's been going on in the health sector. And perhaps one of the drivers that would be a force for good, if it encouraged clients and different professionals to work together. And therein lies a challenge going forward. So my very grateful thanks to all my panel. My very grateful to the audience from around the world for your questions and your participation. Just to remind you that the recognition of the security professionals who are doing a good job, individuals, teams, companies, initiatives, the OSPAs, the Outstanding Security Performance Awards, are open in all these countries. So please do, if you're in India, US, Benelux, Kenya, Romania, Australia, or the UK, do put forward those who are good at what they do. There's never been a more important time to understand who's doing an outstanding job. It matters who's good, it matters who's bad. Let's find who the good ones are. And we go through it all again next Tuesday, when we have a webinar on responding to fraud and economic crime. Where can we look for good practice post-COVID-19? That one was inspired by one we did recently on economic crime. Different panel altogether this time, based around those who've taken part in the TECAs. So once again, my grateful thanks to everyone, to Christine Brooks and Hannah Miller in the background, who are the real stars of this actually. They do all the work, I'm just the front to this. And to all of you, and for those of you in the UK, you have a bank holiday weekend, enjoy that. But wherever you are in the world, stay safe. Thank you.